Why are there so many celebrities telling you what to do with your Medicare during this time of year?
Hi, folks. It's me again, George Foreman.
Well, we're gonna break it down in today's video. Joe Namath and his friends are being paid to make commercials for one very simple reason, and that is to get you to call the phone number on the TV screen that you're seeing.
Call now.
The reason these commercials pop up in large numbers this time of year is quite simply, they work. Also, Medicare interest is at its peak during the open enrollment period from October 15th until December 7th. Although these commercials work for the people paying millions to make them, they don't work for you, the consumer. In fact, Medicare has seen a huge increase in consumer complaints over marketing in the recent years. Complaints have actually increased from 15,497 in 2020 all the way up to 39,617 in 2021. And this is without even including the month of December. Now, I'm not trying to say that these commercials and the companies that make them are the only reason these complaints exist, but they are certainly part of the problem and contribute to overall consumer confusion. So we will try to eliminate some of that confusion and highlight what these ads are actually trying to sell you so that you can confidently mute your TV the next time that they are on. First, I want to be very clear and say that almost every single one of these commercials is selling one type of product. And you may have guessed it, that product is Medicare Advantage, also known as Part C of Medicare.
Make sure you're getting a Medicare Advantage plan.
Now, these plans are alternatives to original Medicare, and they are offered by private insurance companies. Unlike many other agents on YouTube, we don't think Medicare Advantage plans are evil or that they should be avoided at all costs, but we do think it's very important to understand how these plans work and how they are different from Medicare Supplement plans, also known as Medigap plans. So if you want to learn more about the differences, make sure you click the link in the corner of this video and then watch our video about Medigap versus Medicare Advantage. But for now, we will go back to talking about the Medicare advertisements. We will also want to make it clear that these commercials are in no way affiliated with Medicare or the federal government, something that they are nice enough to put, of course, in small font on your TV. Instead, if you call these so-called helplines, you will be connected with a call center full of insurance agents that want to get you enrolled in a Medicare Advantage plan. Remember, just like us, these insurance agencies, they are paid a commission if you enroll in a Medicare plan through them, and those commercials are not cheap. So they really have to focus on those enrollment numbers. The agencies behind these commercials are not even selling unique plans. Any local Medicare broker like us can provide the same Medicare Advantage plans. So aside from celebrity spokespeople, these commercials typically have one thing in common, and they are pitching extra benefits that you deserve.
I called to get everything I deserve.
I called to get everything I deserve.
What are these benefits? We'll talk about that now. But first, give us a comment below this video and let us know your thoughts on these Medicare commercials. Now that you've done that, keep in mind that these commercials are being broadcast to a national audience, and they will repeatedly say you may qualify for extra benefits not covered by original Medicare. This is strategic so they can cherry pick the best benefits available in a small number of counties around the country, and they can advertise them to you to pique your interest since they really don't know if you're in South Florida or South Dakota. You may even be thinking to yourself, are these extra benefits even real? Or are they just another scam trying to get me to call? And we can actually confidently say, yes, they are real, but you have to find out what is realistically available in your specific location. So with that being said, let's go over some of the common benefits being advertised. One of the big ones is all-in-one coverage for dental, vision, and hearing, as well as prescription coverage and other benefits commonly advertised in these ads.
Include dental, vision, hearing, and prescription drug coverage.
But these benefits are pretty much how all normal Medicare Advantage plans function. In fact, you can see right here that in the Medicare and You Handbook, most Medicare Advantage plans bundle medical and drug coverage and include extra benefits. Here is also a chart from the Kaiser Family Foundation that shows the percentage of Medicare Advantage plans that do offer specific extra benefits and which benefits they typically offer. Another thing that is advertised in these commercials are $0 per month plans.
Most plans even have a $0 premium.
Again, this is extremely common for Medicare Advantage plans. In fact, you can see again here with the Kaiser Family Foundation chart, a majority of Medicare Advantage plans on the market are offered for a $0 additional monthly premium. But we often get asked, isn't that too good to be true? Nothing's free, right? Well, if you watch our other Medicare Advantage plan videos, you'll know that Medicare Advantage plans, they are directly funded by the federal government, and therefore they are able to be offered by private insurance companies typically at no additional premium to you. Also, the $0 premium, it doesn't mean you won't have copays, it doesn't mean you won't have out-of-pocket costs when you need medical care or prescriptions. Lastly, if you do want to enroll in a Medicare Advantage plan, you will still have to be enrolled in Part A and Part B of Medicare, and therefore you will have to pay your Part B premium, which in 2023 will be at least $164.90 per month. But now in the commercials, they try to help you with the Part B premium as well. You have probably seen commercials in recent years that talk about getting money back in your Social Security.
And the benefit that adds money back to your Social Security check every single month.
Again, you may be thinking this can't be real, but it actually is. Although, like everything we talk about, it may or may not be available, or it may not be right for you. There are generally two options to reduce your Part B premium. The first is enrolling in what is called a Medicare Advantage Giveback plan. These do pretty much what the name implies. These specific Medicare Advantage plans, they reduce the amount you pay for your Part B premium. However, there is usually a catch with these plans. So one, they are not available in all areas, and if they are, it is very rare to find a plan that will actually reduce your Part B premium by the full $164.90 per month. And two, these specific Medicare Advantage plans, they often have lower levels of medical coverage, and they even may have no prescription drug coverage to compensate for reducing your Part B premium. Some coverage sacrifices likely have to be made to get those lower premiums and those givebacks. Now, another way that your Part B premium may be reduced is if you qualify for Medicaid and a Medicare savings program, which means your state essentially covers your Part B premiums for qualified lower income individuals. Again, Joe Namath is saying you may be eligible for these things shown in the ads, and it may not apply to you, but it will apply to a smaller handful of consumers that see these.
Make sure you're not missing out.
Now, the last extra benefit being pitched by these commercials that we will talk about is one that keeps gaining in popularity, and that is Flex Cards.
The Visa Flex Card gives you extra money to personalize your Medicare.
So are they a scam? No. Just like all the other benefits we mentioned, they are real, and they are included in certain Medicare Advantage plans. Now, these Flex Cards, they often function as a prepaid debit card to provide extra money for things like dental, vision, or hearing, and some even include coverage for groceries and utilities.
Is it your impression that the government puts money into this Flex Card and then hands them out free to citizens?
That was my understanding, yes.
However, these are not provided by the federal government, and they are not something that you're entitled to unless you enroll in a specific Medicare Advantage plan that does offer them. So don't get sucked into the wrong plan just for the promise of a Flex Card. Lastly, just know if there are ads promising very high levels of money in the Flex Card,
The ads are everywhere, most of them claiming there's $2,800 available, but they're confusing.
or they're saying it covers things like I mentioned, utilities and groceries, they are probably referring to plans that are only available to those with both Medicare and Medicaid, which are also known as dual eligible people. So what can you actually do with the information that we presented in this video? Does this mean you shouldn't reach out to anyone for help with your Medicare? Of course not. Just make sure you connect with an independent broker that has knowledge of your specific area and the realistic plans that are available. If you want to connect with us, you can find a link below in the description of this video. Don't be afraid to work over the phone with agents either. Just make sure you avoid these large call centers behind these ads with very few experienced employees. If you want nothing to do with insurance agents, you can even reach out to your SHIP counselors in your state, and they can help you compare your options. So if you only take one thing away from this video, it should be that almost all Medicare advertisements on TV are pitching Medicare Advantage plans. If you want the extra benefits being advertised, just know you will have to change to a new Medicare Advantage plan, and if you're leaving a Medigap plan to do this, you may not be able to get it back in the future without qualifying based on your health at the time. Now, of course, this varies by state, so just contact a broker for more details. If you call one of the numbers on an advertisement and you give them personal information because of the promise of extra benefits, you will be enrolling in a new plan and you will be surprised in January to find out you don't have the same coverage you thought you did. Like all things when it comes to Medicare, it's okay to seek out new benefits and coverage, but make sure the new plan you're enrolling into fits most of your medical and prescription needs, and don't just focus on the flashy benefits that JJ and Joe are yelling about.